Good afternoon, everybody, and Happy New Year. Welcome to our 2025 Legislative Open House. I'm Brooke Lovelace. I'm the Executive Director of our Iowa Developmental Disabilities Council. It's really kind of hard to believe that the session is already upon us, but here we are. A big thanks to the legislators that are here today that could join us. I know your time is very valuable, and it's going to even be more so starting next week. So thanks for taking some time out this week and joining us. We are recording this, so we will be sending the recording to all legislators who couldn't be here with us today. Just so you know, we do this open house every year, usually before session, so legislators can hear about some of the issues that are affecting Iowans with disabilities and their families, and then some policy changes that could really make a positive impact for people with disabilities in Iowa and for their families. So we do have a lot to cover today. In our 1 hour. So we will not spend a lot of time going over all the council does today, but I would be happy to visit with you about that at a later time. And Emily, you can probably go to the next slide. There we go. So you can see there, that's what our mission is. But just briefly, we are federally funded and we're charged to help improve the lives of people with disabilities and their families and to make our communities stronger for people with disabilities and their families. Our work is guided by 24 members of our council who are appointed by our governor. 60% of those folks have to have a disability or have to be a family member. And many of them are here today and may have reached out to you to invite you to attend. They really are, our council members are our connection to the communities across the state. And they help guide our council and let us know what issues are affecting Iowans with disabilities and what issues people care about. And so you'll learn a little bit about that today from our council members and from other people with advocates with disabilities that are here with us to share their stories. So with that, we have two of our council members I'm going to turn it over to. Wendy Anderson is a council member who serves as our chair, and Caitlin Owens serves as our co-chair for our policy committee. So that's Wendy Anderson, who's our chair of our policy committee, and Caitlin, who's the chair of our co-chair of our policy committee. Sorry, that was a little bit confusing, but I'm going to turn it over there and they're going to kick it off for us today. But again, welcome everyone.
Okay, awesome. Thank you again, everyone, for coming. You can go ahead and move slides forward. So really, here's today's agenda, and the council develops our public policy priorities really by listening to Iowans from around the state, talking to legislators about what changes are possible to help Iowans with disabilities live their best lives. And we do this through listening sessions, town halls, our annual conference, surveys, and things like that. So this is just our quick agenda here. But then I'm going to introduce Carlin. Sorry, mind all of a sudden went blank. Carlin is the policy advisor for the DD Council.
Thanks, Wendy. That was a quick turnover.
Sorry.
Move it along. Thanks, everybody, for joining today. We're so happy to be able to talk to you before the session because we know once things get rolling, it's hard to grab everybody's attention. So thanks for joining. And we are, as everybody mentioned, here to talk about our priorities. And the way that we break things down in our priorities are by the sections that are listed here. Last year, if you were on last year, you're going to hear some very similar priorities and suggestions. What may have changed more is what the stories are people who we work with who help guide us in what changes may be necessary and what we should be working towards. So we've invited some folks with us to be with us today to kind of update what's happened to them in the last year since we've been talking about policy change and priorities, and that could be what's happening in their own lives. And I know some of our speakers work with other people with disabilities, so they can speak on behalf of being providing assistance or services to people working with people who have disabilities, and then also people who are providers, and also from a policy standpoint, what were some changes that were either introduced last year, maybe didn't move forward, that we're still going to be working on this year. So we kind of hope to touch on all of those things and really help it focus in, though, on the lived experiences that people have and why these policies changes may be important to them. So I'll kind of introduce each section and talk a little bit about the priority and what a call to action may be, and then turn it over to each speaker to elaborate. So if you could move the next slide forward, I think we might have had one more thing to talk about before so this is our public policy priorities in a publication format. This is what it looks like on our website, and we do have a printed edition that we've provided to legislators. You may have seen it last year. It's going to look very similar this year, and it goes into more depth than we are going to go into today. A lot of this might be on the screen, but we're not going to, again, go through it in detail because we want to focus on those lived experiences and stories, which are also included in our priority document. So you can read about some of the people who are going to be on the call today, their stories, and then also some others that we have included to show examples of what could be changed and what might make positive change. And in addition to our public policy agenda, that more materials that we produce that could help legislators and advocates are on the next slide, which is the Guide to the Legislature, which is a big document that, again, is on our website and also is in printed form. And it lists each legislator, your district, what your committees are. It really helps provide a resource for advocates to know how to contact you, and gets a little more background information. And then we produce a bill of the week that focuses on a proposal that would have an effect on people with disabilities and what those effects might be. It includes data, some facts, the bill sponsor, or maybe even a story about how this has impacted someone already. And then from our priorities, we also pull one-page documents to be a kind of a quick handout to talk a little bit more. Even though that one has a lot of text in it there, we have others that are a little bit more quick reference guide to back up some policy information with data and terminology and things like that. So this is hopefully some information that many of you have already seen and maybe not sure where it's coming from, and hopefully now you know. So to move right along, we're kind of going in, I don't want to say reverse order, but a different order than we've done in the past. And we're going to talk about employment last, which is kind of our biggest area of emphasis this year, just because of momentum that has happened last year. All of these areas are important, and each have their own unique areas of interest and attention. But we're going to start with accessible voting this year. And we have Roger Erbelding and Helen Mija, and sorry, Helen, I left your last name off of the slide, who are with us from the National Federation of the Blind in Iowa, and have been working on both voting accessibility and prescription medication accessibility for the past couple years. And we asked them to come on today and talk about what they're working on. So I'm going to move right over and ask Roger, hopefully, to chime in. Are you there, Roger? Emily, do you know
I think we're on. Now I got it covered. Can you hear me?
I can hear you.
Okay. I I asked Helen Mejia. Helen's our state president of our federation to join us too, and I'm going to give her the ball to carry. And Helen, anything you leave out, I'll pick up for you. But go right ahead.
Sounds good. Thanks, Roger. Can everyone see me okay? I'm in a different place than I usually do these, so just want to make sure it's all good.
You're good.
All right, thanks. So, as Carlin already mentioned, the two issues that we've been focusing on with the Iowa legislature the past couple of years relate to accessible absentee voting and prescription drug labels. And both these issues, I'm going to focus on the specific experiences and benefits of Iowans who are blind or low vision. However, from the connections we've made, these needs apply to a much broader segment of the Iowa population, older individuals, individuals with other disabilities, etc. So I can start off with the prescription drug labeling bill. And I do want to give a shout out. I saw that Representative Barker is on this call and he has taken, a significant lead in this issue of late, and we want to thank him for that. So we have members who receive their medications in bottles from the pharmacy and aren't able to access the information to know which medication is which easily because they can't read the print labels, can't read the packaging, the materials that come with it, etc. And many pharmacies offer services to help with this. There's a range of different tools. Some pharmacies have contracts with companies that will print braille labels for them. There are a couple different devices you can add to them to give audio tags that then can be read out loud. Range of ways to make this accessible, but not every pharmacy in the state offers that. We've had experience of members who've asked for it, whose pharmacies have been unwilling to do it, or even cases where, because a pharmacy changed ownership, a pharmacy that used to provide one of these options then no longer did. So, what we're asking from the legislature is to make it so that pharmacies, when a person asks for an accessible label, that the pharmacy provides that for them. And again, that could be, depending on the needs of the person. Most commonly, this is a tag that allows audio information. So to hear, okay, this is your 500 milligrams of whatever. That's the most common way because that works for individuals who are just losing their vision or any, wide range of people with print disabilities. So that's the short version on that. Accessible voting, right now, if I want to vote absentee, not in person, I have to have somebody else help me do that. I can't fill out the piece of paper by myself, sign it in the correct places, get it mailed back in. What we're asking for is to be able to vote privately by absentee ballot just like anyone else does. Being able to use, and there's again, we're not saying which specific tool to use. There's a range of different options that other states use for this to be able to receive the ballot in an electronic format, or we can use computer software that already works in the same way that I'm using a computer now, where it's reading out loud what's on the screen, to fill out the ballot and then to be able to send it back through an electronic system. For us, having to print the ballot and sign it in all the correct places still means somebody else is going to have to see that ballot, which then removes the privacy. So working towards that so that we can have that same access.
Helen, I want to add two real quick things on the voting issue. Even when you go to the polls and use the accessible machine, sometimes the ballots are a different color or a different size. I've run across this when I voted, and therefore that is no longer a secret ballot, and it's differentiated from other ballots that are submitted in the ballot box. Representative Barker, I want to thank you publicly for your cooperation and support and friendship and everything else. Very much appreciated. And then we're going to be at the Capitol on Tuesday, February 10th. So you'll be hearing from us before then and seeing us on that date. And again, all of you guys out there, thank you. Thank DD Council, thank you, thank you, thank you for your cooperation and efforts with us. Much appreciated.
Well, thanks for that, Roger and Helen. And Helen, you did an excellent job describing and educating us on those issues. I know it's complicated for many of us to understand um, what things are needed. And it's been very helpful to be able to work with your organization to help educate all of us and also to hopefully educate the legislature on how these changes can make a difference in all of your lives. So we look forward to working with you all on this year too. And thanks for bringing that information to us. Okay, I think we're going to pop back up to a slide that we skipped over, which is basically just an overview again of kind of these sections that we're going to talk about. But just wanted to emphasize that the keys to success for people with disabilities in Iowa are the same as they are for other Iowans. Sometimes there just needs to be a different approach to how these keys are unlocked for people to be able to survive and thrive as Iowans. So employment, quality education, supportive communities, which includes healthcare, and also voting as a right and as a way to be civically engaged and make change in your community. So we just skipped over that slide earlier, so I wanted to make sure we got that in. As we move to our next section, which is community living and healthcare. This is our goal with accessible voting, is that all Iowans have access to voting options and are able to vote. And you heard some of the calls to action from our two speakers. So we're going to go right over to community living and healthcare. So our goal here is to have Iowans get with disabilities get the support they need to live in their community or live in their choice of a living situation, which usually means not having to move to an institution or out of their own home. So they're able to get the supports that they need to live in their community and get the health care that they need that way too. And so this is a big area that we all work on every year that mostly focuses on Medicaid and home and community-based services, waiver programs, and making sure that Iowans' needs are being met and addressed by these programs. And to talk with us today about this area is Stacy Ring from Council Bluffs. She spoke with us last year about some challenges that she was having with her son Alex, who is transitioning out of high school into adulthood. It's a huge and very challenging time of life for people with disabilities and their family members, and making sure that they get the care they need when they're making this transition, that the care and supports that they need. And Stacy has some other insight she's also an advocate for other mothers and family members like her. So she works a lot in her community to help others. And so she is here today to talk to us more about how things have changed for her in the last year and what things that we're looking out for the coming year. Thanks, Stacy.
Thank you. Thanks for having me. Hello, my name is Stacy Ring, and my son Alex is a 20-year-old individual who lives here with our family in Council Bluffs, Potawatomi County, and he has autism and intellectual disability and anxiety. Our whole family, we're lifelong residents of Iowa, and my husband and I both work full-time professional careers, and we have 3 other children who are typically developing, healthy, gainfully employed people who are 28, 25, and 18. Our son Alex has now been on a Medicaid waiver for over 10 years. I think it might be getting closer to 15 now. And initially, when he was a younger child, the waiver provided coverage for things, medical services, especially his occupational, speech, and physical therapy services that would have otherwise been out-of-pocket costs for us because of the private commercial insurance that we had. So it basically paid the out-of-pocket deductibles that we would have had to pay, which saved us probably $10,000 to $20,000 a year for all those years where he was receiving those services. It allowed for some things to be provided to Alex in our home in the form of respite services, which allowed another safe caregiver to be with him while we either ran errands or attended events for our other children because he wasn't always in a place where he could go to those things and behave appropriately. And it also gave us some supported community living services, which allowed someone to come in and help teach him and help him build independent living skills and self-care skills and practice those at home and in the community. And when he turned 18, which was about 2 years ago now, and was preparing for a transition from high school, we requested through Medicaid to expand the number of services that he got, the number of hours specifically that he got in supported community living to help him practice and maintain independence at the highest levels that he was able to as a now adult person. And his managed care company denied about half of the hours that we were asking for. So we went through the appeals process and ultimately had to appeal to the state fair hearing. And the judge fully sided with the hours that we had requested, and in fact said that based on the evidence presented, that he probably required 24-hour care and supervision, but we were only asking for about 8 hours a day. So last year, when I spoke at this event, we were awaiting a decision on whether his services would be approved or whether we'd have to go through the appeals process again. And thankfully, they were approved without incident. So we are this year again waiting for a decision about whether his service plan, which starts February 1st, will or won't be approved. And this year, I'm actually probably a little bit less confident about that being approved without incident, mostly because of the confusing and contradictory messages that really seem to be out there, especially on the federal level, but even within our state about these home and community-based services and the waivers and Medicaid itself. So there's a few things that I do want to be clear about. First, our son wants to live at home with us. He wants to be with his family. That's his stated preference. It's also really the safest place for him to be. There's a lot of evidence that you may be very familiar with as Iowa representatives about individuals who have been in our state facilities who have died or who have been neglected or physically or financially abused in our systems. And that happens also a lot in privately run facilities. And we don't want that to happen, obviously, to our son. Home is also a much more cost-effective place for him to be compared with a state-run or a privately run facility. Also, my husband and I are working professionals. So we both go to work 40 hours a week and take care of our son. And we need to go to work so that we can have private insurance for ourselves. And Alex is still covered under our private insurance in addition to Medicaid, but also so we can continue to contribute to our 401ks. Because financially, I'm not all that confident in Social Security either for my own retirement. So we need financially to be able to still go to work. And our son does require 24-hour services. Throughout his life, we have worked together as a family with my husband and I, with our older children, and now our 18-year-old son, as well as my mother and some other people, to make sure that Alex always has what he needs and has someone with him, even if that was in excess of what his waiver was able to provide. And currently, he attends a day program that's paid for through transition services through the school district, versus his Medicaid waiver. But when he turns 21, which will be late this year, that will change, and he will need to transition to Medicaid funding for day services, or he will not be able to have day services, and he would then be at home with the need for supervision there. And so my final concern, circling back to something I said before, is that our family is very worried about those home and community-based service waivers, and Medicaid itself, based on messages that have been sent within our state about revamping those waivers and services, as well as the federal messages about targeting Medicaid funds, even though there are statements that there's an assurance that people who are on those services won't be affected, and that those home and community-based waivers will be intact. There's a lot of uncertainty about that. It just doesn't seem to make sense. It doesn't seem like it's going to be quite that clean and simple. So this causes a lot of uncertainty for our family, but we have the certainty of knowing that we'll figure it out. And as Carlin mentioned, one of the things that I also do is I, like many other family members, serve as a resource to others who are in this same situation. And many of us are concerned that we won't be able to meet the needs of our loved ones, or that individuals who are currently kind of on their own meeting their needs will lose the supports that they have to be able to do that. In fact, right now, the day program that my son is going to, that's paid for through the school district, does not currently have a contract with Iowa Medicaid. They're in the process of doing that, but it is a longer process. And they were actually asked to come into Iowa to provide services for voc rehab, because there is such a shortage of providers, especially in our part of the state, for vocational and employment services, and also for day and home-based community living services. So, if there are cuts to Medicaid, there will be cuts to lots of his services and lots of the services that many other people in our part of the state need to be independent and successful. So those things really concern me, as well as the lack of accountability for a lot of the managed care companies. One of the families that I'm currently working with has a child very much like mine, who is living in her own home with support, 24-hour staffing support, and her service plan was set to start December 1st, and they did not find out until December 12th that her service plan was drastically cut, not only in the number of hours, but the amount of money that her staff could be paid. So her staff had already provided almost 2 weeks worth of services, and then found out later that they would A, not be compensated for all of it, and B, would only be compensated for a fraction of their hourly wages. So they're now in the process of appeals, but that takes usually months to get through. In our case, it took about 6 months. And the family is very concerned about how they're going to provide care for their loved one. And this is just uncertainty that caregivers don't need, especially because so many agencies and individuals who provide this care are finding that it's really just not worth it anymore with the uncertainty. They need guaranteed income, like many of us do, to pay our bills. And so that leaves those individuals who are already vulnerable even more vulnerable with not having effective caregivers and enough caregivers to draw from in our areas. So that's what's going on with us.
Casey, thank you for sharing your story and also for what you do to help other families who are going through situations like yours, and especially in your area of the state too. So I really appreciate that. And if we hadn't mentioned it earlier, we have time at the end for questions. So if you can stay on, Stacy, too, in case people have questions, really appreciate that. And we're going to move on to our next two areas, which education and others. We'll put up a picture of Alex, so you all see Alex, who Stacy talked about. And that's the story that was in our priority booklet. Two of the things that we're going to talk about then that actually flow nicely. Well, I don't know if it's nicely, but logically from what Stacy was talking about are education and employment, which especially as you're going through this time of transition from school to work or whatever is after school, there's so many unknowns, and it's a very volatile time and easy to lose services, as Stacy mentioned. But there are some ways, some kind of unique opportunities that we have to make sure students are getting what they need in post-secondary education, hopefully to be able to transition to employment if possible, or to what they need from their community services. And one of our goal with education is that students receive the supports they need. But some of the calls to action, if we can move on to that, look at some of these unique programs, such as a comprehensive transition program, which allows a student to move into a college program that teaches more independent living skills and employment skills. And that we're going to talk about that here with our speaker, but also wanted to mention that more support for voc rehab is something that we hear a lot. It's our voc rehab services in Iowa are doing a great job with what they have, but there still seems to be a big need for this time of transition. So although we don't have anything proposed at this point, it's something that does affect what we are going to talk about with comprehensive transition programs, because sometimes as students move through these programs, they are ready for employment, and there's not the supports that are needed there to help them get the employment. So I'm going to turn it over to Bill Lloyd, who is with the University of Iowa REACH program, which is a comprehensive transition program in Iowa. We have several of them, and he can mention those. But what we've been working on the past couple years is to increase access for students to be able to get into these programs. They are expensive. They require a lot of structure and organization, which is what Bill does. But from the side of the individual, it's not something that's available to everybody, and we would really like to be able to have more opportunities for students to move into these programs, since there's a need, especially as we try and move more people into employment. So take it away, Bill, and thank you for joining us today.
Hi, Carlin, and hi, everyone. Thanks for the invitation. Happy to be here with you today to talk about some exciting opportunities for students who are neurodiverse. Now, these students might have an intellectual disability, or they may have autism, or they may have a developmental disability, or ADHD or ADD. But in the relatively recent past, an opportunity has emerged that these young students can have the same college experience that their parents and other siblings and other family members and friends have had, and come to college and earn some skills that will help them move into employment after attending, and further their independent living skills. UIReach is one of over 360 programs across the country that are called inclusive post-secondary education programs. And we focus on students who learn differently, and we build in the supports that are needed to help these students be successful in their college quest. as Carlin said earlier on one of the slides, anybody can be successful with the right supports. We embrace that, and we embrace the notion that inclusion is the way to go. Segregating services is not the way to go, but having students have similar experiences to their typically developed peers is the way to go. So one of 360 programs across the country that were authorized through the Higher Education Opportunity Act in 2008. And these programs came to fruition and are now serving students from coast to coast in the United States. In Iowa, there are 6 such programs, and some of them are nested inside of high school or extensions of high school programs. Others are at community colleges and universities across the state. Again, UI Reach is only one of 6 that are here in Iowa. We've recently formed a nice little coalition of all of those programs, and we come together and discuss best practices and ways to support students' dreams for success through attending college. So we're really excited to be a part of that. Students at UI Reach go on to become employed at a rate of 96 or 91% of our graduates actually finish our program and become employed. That's the main focus for us, becoming employed. 60+% of our students go on to live independently or semi-independently, that is outside of mom and dad's house, and enjoy living in the community and becoming a contributing part of the community. So the results these programs produce is tremendous. And so we consider it an investment when we can make that pathway accessible to more and more students so that they can attend programs like this across the state and indeed across the country. Of course, college is expensive, right? That's true for everybody. So we need to make sure that the accessibility is there financially. And that's where the bill that I'll talk about is of such great importance. Limited access for these students, because most of these programs don't offer a degree, students do not qualify for student loans. They may qualify for Pell Grants, but the resources available to families to help students access these wonderful opportunities is quite limited. Well, about 3 or 4 years ago now, Chad Ingles introduced a scholarship bill that would set aside some money through the appropriations process to have students have access to scholarships to attend programs like that. It's been unsuccessful in the last 3 years, but Representative Ingles is going to reintroduce that bill again. However, this time he's hoping to reintroduce that bill under the Iowa Grants Program, which is open to most students who want to attend college. And that will not require any additional appropriations. He's just including our subset of students in the eligibility requirements for those funds. So Chad has shared the plan to relaunch that effort again this year, again through the Iowa grants process. It would give our students some of the same levels of funding that other students get when they come to college, and we're hopeful for your support in that initiative. We are also hopeful to raise your awareness of inclusive post-secondary education programs across the state. So we'll be visiting you at the State House throughout this year. We've met with folk before, like Art Stade, who's on the call today. Thank you, Art, for being a great supporter of programs like ours, and others who have come to the forefront to say, hey, we realize that this opportunity exists and we want to support our young people to do it. Again, finishing college, getting a job, living independently, becoming a taxpayer, having a work life, having a social life in the community is what these programs are all about. And so we'd appreciate your support in making this access higher by creating vehicles like the Iowa Grant Program for students who want to attend these inclusive post-secondary education programs. I mentioned UI Reach, but there are several others. There's the Access Program at Eastern Iowa Community College. There's the Education and Career Training Experience, or Educate, at North Iowa Area Community College. There's the Northwestern Next program. It's at Northwestern College. There's the RISE program in Indian Hills Community College. There's the Strive Academy in Des Moines. College, Des Moines Area Community College. So those are some of the programs that are out there now. Kirkwood is emerging with the program, and other programs are trying to get started. Other states are doing some amazing things with creating infrastructure dollars. But right now, we would just appreciate your support in creating access for students so that they can help to offset the cost of attending programs like ours. Okay, so our students they are able to stay for up to 4 years, but they when they finish, again, achieve amazing outcomes. So thanks again for listening today, and would appreciate your support on Representative Ingles' bill to include these students in the Iowa Grants Program. I see some of the questions in the chat, Carlin. Yes, you are, like I said earlier, most of these programs, most inclusive post-secondary education programs and comprehensive transition programs don't offer a degree. By virtue of the student's disability, intellectual disabilities and others, the students might not be able to matriculate through all of the subject matter that's necessary for that. But what we offer is credentials and enhanced credentials. Some of our students have gone on to do things like earn a certification as a welder, or as a paraeducator, or as a food service worker, or as an office worker. And we help them get credentials while they are here in our program that help foster that employment moving forward.
Well, thank you, Bill. Thanks for all that information. And again, we'll keep taking questions. And both Representative Ingles and I have had kids who've gone through the REACH program, so we'd be glad to speak to anybody who might have more questions about specifics, and we both know how much it costs. So this is why we're both pretty would like to see more students be able to access this, because I can just speak personally that never thought my son would be living on his own after graduating from the University of Iowa, which was never thought would be possible. A special program called REACH that it is, but it puts them on campus and makes them feel like they're just like every other Hawkeye in the state, and there could be similar programs at Iowa State too. We're hoping for, so it could be more Cyclones and Bulldogs and everybody else too, and it's a great program. So we're going to keep working on that, and I'm just going to mention Representative Ingles here as we move into discussing employment. He was going to be on the call today, but he had another meeting, wasn't sure he was going to be able to make it. He's also working on a bill that would provide tax incentives for employers who hire people with disabilities. There are some tax incentives available now, but from what we hear from employers, they are cumbersome to apply for and get, and many of them are not using them. So it's one of the pieces of the puzzle that we're working on with the whole employment, what should we call it, matrix, to get more people with disabilities, especially intellectual and developmental disabilities, moved toward employment. So as we look at our next section here on employment, and it flows right from education to employment, as Bill mentioned. This area of emphasis, employment, is about having Iowans with disabilities have competitive jobs, and where they are included in an inclusive workspace. And it's complicated. There's additional training that's needed. There might be additional schooling that's needed. There's supports, as Stacy mentioned, that move from school system support to Medicaid that help people with job training and job development. And there's a lot that goes into it that could be helpful. So our call to action is not there. There's not one thing that's going to make the difference. There's a lot of things that could be put into place. But there is one thing that we've been working on more in the past couple of years, and that's removing some of the barriers that don't allow people with disabilities to earn to their full potential. Because many individuals with disabilities are either working part-time or they're working in jobs that don't provide private insurance, or because they have needs, healthcare needs, service needs that are not met by private insurance. Most of them are eligible and receive Medicaid. And Medicaid limits how much you can earn and how much you can save. Um, and that limits a person with a disability's um, ability to earn to their full potential and maybe not get the jobs that they would really like to have because they have to stay on Medicaid to get the health care that they need. So one of the issues that we've been talking about most strongly the last couple of years is removing those income and asset limits for people with disabilities, Iowans with disabilities who work, and so their pay and their what they can save and purchase is not limited by their employment. Nobody else who works is limited in how much they can work so that they can keep health insurance. So it's kind of a backwards way of looking at supporting people with disabilities and not being able to support them by having them have health insurance. And some of the other, policies that could contribute to reducing other barriers are things like tax incentives for employers so that there can be more training programs. We've seen a lot of people with disabilities want to go into business for themselves. And that's an area that there was some growth, that the state was investing more in self-employment programs, and they've cut back on that through voc rehab. So there's many other pieces to this puzzle, but the one that we're focusing on in the coming year is the income and asset limits. And we have two people today to share their personal experience in this arena, and that's Zach Meekum and Alex Waters. Some of you may have heard them speak before. They spoke at the Capitol last year, and want to get an update on what they're been working on and what they're going to be working on this year and what's up with them. So, Zach, are you going to kick us off here?
Yeah, that's fine with me. Hi, I'm Zach Macom. I am self-employed homeowner, Iowan with a disability. You might accuse me of being a serial entrepreneur since I had started my first business when I was 19 and have been self-employed in some capacity ever since. Right now, I own and operate Zach of All Trades Media. It's a digital media company that provides marketing services from businesses of all different sizes, all over the country. Um, it's something that I'm really proud of. I get to do a lot of great, interesting work. Um, but the unfortunate reality is that I've always had to keep my business pretty small and pretty lean in order to make sure that I qualify for Medicaid. And it's necessary for me to qualify for Medicaid because in order to live on my own, in my home, like I do now, I need personal care. And that personal care is only covered by Medicaid. I've done the math. If I were to pay for my personal care out of pocket and I wanted to maintain my level of income right now for my own personal expenses, I would have to make close to $150 to $200,000 a year just to be able to maintain the lifestyle that I have now and pay my caregivers out of pocket. And the thing is, I believe that my business could easily generate that much revenue, but there's going to be a long period of in between time where I wouldn't have health care. And there's no possible way that I could get to that level of success without the personal care that I have now. So an artificial barrier has been created that punishes me for having any level of success. I'm also like an inventor, and a business that I would love to start is a line of 3D printed wheelchair accessories for people with disabilities. The device that's holding up my phone right now, I invented. And this is what I use every day to operate my phone and to hold it for videos like this. Um, this is a device that could help a lot of people. but I can't start that business because when you're selling a product, you don't know how much money you're going to make. And I don't want to risk losing the health care that keeps me independent in my home. And this is a policy that we've been trying to change for years now at the Capitol. We've been really working on it. And right now, we're in the middle of something called the Let Us Work campaign. Let Us Work is exactly what we're talking about. It's just helping Iowans with disabilities like me have an opportunity to be really successful by removing the artificial barriers that prevent them from doing so, removing those asset and income limits so Iowans with disabilities can save and work and contribute to their communities at the level that they want to. And I think that we need to do that because I think that not only does that allow people to live fuller lives, but I think it's just fair and good common sense.
Thanks, Zach. Alex, are you ready?
You better believe it. Yeah, Carlin, I appreciate the opportunity and I appreciate everyone for their willingness to hop on. I know it's been a long, almost an hour. It's tough to keep that attention span. So I'll try to keep it entertaining and keep the conversation going. So, but I think first and foremost, it's important just to give you a little bit of a background. If you've heard my story or at least my background a little bit, I apologize. I'll try not to lull you to sleep, but I think it's important for context for everyone. So, my name is Alex Waters. I'm joining you from Sioux City. That's right, Iowa's West Coast. It is in Iowa. And I previously served on the city council for the last 8 years and am full time employed at Morningside University as the director of alumni engagement. But the importance of being on this call is an accident that took place when I was 18 years old, 2 weeks into my freshman year at Morningside. I was involved in a diving accident, and actually, as a result of that, I had a spinal cord injury, leaving me a C5, C6 quadriplegic that uses a snazzy power wheelchair to be able to get around. And after that accident, I was pretty undeterred. I am a driven individual, you could say. And I went back after that accident to get my degree and went to college. I actually went to grad school. I got my master's and I became full-time employed. Shortly after that, I bought a vehicle of my own that I can drive. Yes, you should be worried if you see me coming down the street, but I was able to purchase that vehicle and I was able to buy my own house that I live in. I was chasing the American dream. I'm paying taxes. I'm doing everything. I see a lot of elected officials on the call here today. I understand how hard you're working, not only to serve your constituents, but also to make a living for your family. And I'm doing the same. I've worked really hard. I wanted to serve the people of Sioux City and also just achieve that American dream and do everything I can. However, as a part of that American dream, I want to be able to advance my career. And what I found, as Zach mentioned, is that in order to go to my job, I have to have caregivers every single day that get me up and out of bed. And the only way I'm able to pay those individuals is through Medicaid. Private insurance refuses to cover this. They call it custodial care. And so I must remain on Medicaid for the employed. And with that being on Medicaid, come income restrictions. So every year I apply, I worry that I'm at the glass ceiling and $10 over, I'm going to lose all of my coverage. There's also asset restrictions as far as the vehicles I can own, the money I can have in my bank account, and there's even restrictions on the ability to get married. I've had a couple of different significant others that I've really wanted to get to that step, but it becomes a barrier because suddenly their income counts towards my benefits as well. That's a real problem. But the opportunity that we all have, and you have as an elected official serving the great people of Iowa, is an opportunity that I think is very bipartisan. It's an opportunity to solve or assist in solving Iowa's workforce problem. You see, a lot of companies in Iowa are needing and wanting to hire a dedicated workforce, and people with disabilities are ready to step into those roles. Well, I mean, okay, maybe not step into them since I can't step, but you get the idea. We're ready to take on those roles, and we want to be dedicated to the company and work for the people and the companies of Iowa. But we need to empower them to do it because right now people with disabilities are terrified of losing their benefits every single time they get a raise or they get a promotion. And the truth is this type of accident could happen to any one of you. I was 18, I was on a golf scholarship. I had the world in front of me, and I really was excited for that next step. And I would appreciate all of you thinking about if this accident were happening to you or did happen to you or a loved one, what limitations would you want to put on yourself or your loved one? And I think you can look at it similar to what Iowans and elected officials have done with the cliff effect for childcare. We saw that need to keep those individuals in the workforce. So we doubled the cliff effect, the income limit for childcare. We saw the work requirements for Medicaid. I understand you feel passionately that if someone is receiving Medicaid or different services, that you want them to be able to pay into their fair share of taxes and be gainfully employed. We want to, but we need to complete the full circle. We need to support bills like Work Without Worry when it gets introduced, and we need to call for a vote after it passes through the committee. I look forward to coming down and talking with the HHS committee, and I look forward to testifying and explaining why this is so important and how this will solve a lot of problems for Iowans, both those with disabilities, but also the workforce troubles that were really troubling so many companies across the state. So I hope we can do the right thing. It's a bipartisan issue and get it across the finish line this year. I thank you for your time. Really, I do.
Thank you for your time, Alex, and always being willing to share your story. We're running up against time here, so we have a couple minutes for sure left. I want to take any comments or questions from legislators who are in attendance. So we can open that up now. Chat's fine also.
I just wanted to say thank you for the information and especially for those sharing personal stories. And I know you probably feel like you need to share them again and again, but it really does help give perspective and personal experience with how the policies that we have are impacting people in the state. So thanks for taking the time to do it.
Thank you, Senator Barmy. We look forward to working with you on HHS this year.
And for your willingness to take the time to be here. It means a lot, and I know you all are very busy.
This is Senator Stade, too. I want to thank you for your continuing advocacy and look forward to supporting the bill.
Thank you, Senator. Good to see you.
Good to be here.
Well, it's certainly been great to have you all on. Thank you for hanging in there for an hour and giving our speakers time to tell their stories and make their suggestions and asks. This is a wonderful opportunity. So we really appreciate you taking the time today. We do have an event coming up also January 28th. We have a slide on it where some of these same, all of us will be there and many more people. So it's our legislative reception day, basically, and it starts at 2. We'll all be there, and then other disability related organizations will be there, and mainly we'll be talking about employment and some of these issues. I think Alex and Zach will be there again. And then there's will be a news conference to talk more about what's going on in the employment arena with some other expert speakers. And then more discussion in the evening at a taco about employment. How else do you want to talk about employment? Over tacos. So we hope you can all join us for that. We'll send you an invitation and reminders, and good luck with the start of session. And we look forward to talking with you all more.
Carolyn?
Thanks again. Yes.
Yeah, sorry about that. I was trying to figure out how to put my hand up and I couldn't find that. So, um, I drafted a bill this summer. I hope we have it introduced before your event on the 28th so we can talk about it then. But it's changing the job search requirements when someone's on a layoff for individuals with disabilities. So, um, hopefully, again, you'll be able to look at before then. We can talk in the 20, see how that might fit or help your individuals and to take out some of the requirements so it's not so pressing for them.
That's great. I look forward to talking to you about that. I'll follow up with you. Thank you,
Thank you.
Senator. Great. Well, thanks everybody again.